Hello, and welcome to Frontier Nursing University's virtual events for National Nurse Practitioner Week. This session is focusing on the impact of preceptors. I'm Dr. Lisa Chappell, the Associate Dean of Family Nursing at Frontier Nursing University, and we have with us Mr. Charles Davis, who is a current student in the Family Nurse Practitioner program. And Charles and I will be talking about the impact of his preceptor experience. To begin with, Charles, would you talk a little bit about who your preceptor is and how you were able to connect with him or her?
Yes, absolutely. And first off, I want to say thank you, Dr. Chappell. It's wonderful to be here participating in this activity, and it's also wonderful to be with you today. So with this first question, I'd like to share I just completed my first preceptor experience. And I had the pleasure of working with Dr. Yvonne McGuire from Crystal Run Healthcare. And Dr. McGuire and Crystal Run Healthcare is in Middletown, New York. It's just north of New York City, about 60, 70 miles. And Dr. McGuire is a pediatric clinician. And as a matter of fact, she's the only APR in the clinic that she's working, where she currently works. However, Dr. McGuire has all the respect and all the activities that physicians, that MDs or DOs would have. Now, I connected with Dr. McGuire through our state Nurse Practitioner Association. And this particular Nurse Practitioner Association, New York State Nurse Practitioner Association, I joined as a student. And as a student, that opened a catalog of folks through different categories, through different counties as such within New York State. So being a student member of the Nurse Practitioner Association in my state was very important. However, my successful connection was also a result of just constant and continuing dedication to finding a preceptor, following through, and without a doubt, perseverance. It can be a challenge sometimes, but you have to have the dedication, you have to have the drive, you have to have the follow through, and you definitely have to have the perseverance. So there's myriad factors that help me connect successfully with Dr. McGuire. And I just want to encourage anyone who is currently looking for preceptors or will be looking for preceptors in the future, take advantage of the fact that there's myriad factors, and just hang in there. It will happen.
Thank you for that, Charles. How would you describe your experience that you've had so far with your preceptor?
Excellent question, Dr. Chappell. My experience with Dr. McGuire was ideal. I had an outstanding preceptor. And I make that strong statement. I recognize it's a very strong statement, but I make that because, again, Dr. McGuire was my first experience with a preceptor, and she was not only knowledgeable, skilled, and a talented clinician, but simultaneously she was very professional, she was nurturing, she was respectful, and she allowed me to grow in the experience, and that is so very important. So she was, in my opinion, an ideal and model preceptor, and I was very fortunate to have her. I definitely hit the jackpot.
What's your biggest takeaway from the time you spent with your preceptor?
I'm going to answer that maybe a little unconventionally, Dr. Chappell, and unconventionally meaning I'm not going to provide a clinical pearl per se, but some of the sidebar discussions that I had with Dr. McGuire were come to your place of work, come to your place where you're doing your clinical rotations, come there early, be there before your preceptor is there. Uh, be be prepared to provide your patients and their family with evidence-based care and education. All of these are all just common, very common nursing practices that we learned through our undergraduate days, but we need to continue those as clinicians as well, as providers as well, and do that in a very compassionate fashion. And touch base, follow up with your patients. I saw Nurse McGuire, Nurse Practitioner McGuire, Dr. McGuire do that frequently, that even after the patient left the clinic, if there were any issues, if there were any important labs that needed to be addressed, she would often be the individual who would follow up with a patient and do that in a timely fashion. And one thing, just sitting back as an observer sometimes, you got to have fun. You've got to enjoy what you're doing. So in a nutshell, everything that we learned at Frontier Nursing University, bring that forward and bring that into the clinical setting.
Very nice. Thank you. Would you say that your perspective or outlook has changed after your experience of working with Dr. McGuire?
With Dr. McGuire, I have definitely left that uh, experience as a more confident and as a more skillful student. But I couch that, I make that statement with a caveat. I still have a lot to learn. I recognize that. I have a lot to grasp, but undoubtedly, I am much more confident and I am much more skillful. And I know that just based on how I approached patients during the first week and how I approached patients in the following week. So I'm definitely much more confident and skillful, but again, the learning curve is still steep, and I recognize and welcome the opportunity to learn more.
Great, great. Can you share one thing that you learned from your preceptor that you feel will have a great impact on you once you're practicing as a nurse practitioner?
Absolutely, Dr. Chappell. And again, let me answer this maybe in an unconventional way. And again, an unconventional way, not necessarily as a clinical pearl or a day-to-day clinical practice activity. One of the things my preceptor sat down and discussed with me, and we had a lengthy discussion, and it was very informative. She shared with me, as a provider, you are a professional who can negotiate some of your contract terms. So when you go in and are hired, there's an opportunity. You don't have to accept just what is put in front of you. You can negotiate the number of patients you will see per hour. You can negotiate the number of hours that you may work. And she had identified how important that was to her, that some of her MD or DO colleagues would see 4 to 5 patients an hour. She said she absolutely did not want to do that. That was not, that didn't follow the model, for instance, of care that she wanted to practice. And for me, as a future practitioner, as a future family nurse practitioner, that was very important. So rather than be told that you are going to see 5 patients in an hour, which would be potentially disruptive to the care model that nurses and nurse practitioners want to follow. We have the opportunity to politely, respectfully, and professionally push back and bring that total number down so that it matches both how we want to practice care for our patients as well as meet the needs of the clinic, the organization that is interested in hiring us.
Good. Very good. What would you say to a nurse practitioner who is unsure about becoming a preceptor?
Oh, I would sit down with that individual and remind them at one point or at one period of time, we were all, and I emphasize the word all, recipients, and I'm currently a recipient of nurse practitioners who are willingly and with minimal compensation, with minimal recognition, they are willingly giving their time, their knowledge, and their skills. And again, I would emphasize that we are all here today, and practitioners who are practicing today, they are all recipients of those kind individuals, nurse practitioners who gave their skills, time, and knowledge. So none of us would be working toward being practitioners, and none of us would be practitioners today without MPs who gave that committed time. So I would encourage all future and current providers just to think about what you were provided, the opportunities that you were provided because of a preceptor. I'm definitely going to definitely think about that. I'd like to just add a caveat. It's not that you have to accept every student that comes by. In my opinion, it's very important that there be good rapport, good professional synergy, respect, etc., between a student and his mentor or preceptor. So you can be selective, but be a mentor, be a preceptor, and keep advanced practice registered nurses alive and well and going forward.
It sounds like you've had an excellent preceptor, Dr. McGuire. I think she's made an important contribution to your education as a nurse practitioner. And you have learned things from her that you'll carry forth for years to come in practice. So that's really important. Well, thank you, Charlie, for spending time with us today and letting us hear about your experiences of being a student who has a preceptor. And to our audience, I hope that you found this helpful and interesting. And thanks for attending our session about the impact of the preceptor.
Thank you, Dr. Chappell.
Thank you.